if a patient is tolerating her treatment, why not just extend to 10 years?
I think you don't want to extend to 10 years if the patient is tolerating treatment, if they don't derive benefit from it, right? If a patient is on a therapy, just because they have tolerable side effects doesn't mean that they aren't at risk for an adverse event. And I think sometimes it can be, you get comfortable with a patient on a therapy and they're doing so well and they feel so good. Those risks are always still there, and they might be low in terms of like tamoxifen and a blood clot and endometrial cancer, but bone density loss is still an adverse event and it can become progressive. And if your patient develops it and then you have them develop a fracture, like a hip fracture, because they have that bone density loss, it's suddenly not such a benign thing.
Right. I completely agree. And cardiovascular risks and cognition matter too. Aromatase inhibitors, these endocrine therapies, they add points to blood pressure, cholesterol, blood sugar. Patients are more likely to not be able to lose weight despite how hard they're trying. And those things, they're more subtle, but those are adverse effects that we want to minimize because they play into their cardiovascular risk and then the cognition. I've had patients, start therapy at around 65, and maybe it would have happened anyway, but at 70, they're just starting to forget appointments, lose their ability to multitask, and really change. And I wonder what that estrogen deprivation, what the contribution of that is to that change.